My name is Dr. Kevin Scalf. I'm the department chair for the Psych Mental Health Nurse Practitioner program here at Frontier Nursing University. And I'm so excited to be able to come out and talk about our program, talk about the profession, talk about the role of the psych nurse practitioner with you, and see what kind of questions that you might have, and really see what kind of conversation that we can start as we talk about this particular profession. So thank you so much for coming out. Before we get started, I would like to just give faculty and staff an opportunity to introduce themselves. You will be hearing from several of my colleagues during the course of the evening. So I'd like for you to have an opportunity to put a name to a face and so forth. So if my colleagues would want to come on camera and just introduce yourself before we get started, that'd be good.
Good evening. I'm Dr. Susan Piper. I'm the clinical director for the Psychiatric Mental Health Nurse Practitioner program. So excited that you all are here and looking forward to a good evening and answering any questions that you might have.
Hi, everyone. My name is Jamie Wheeler, and I am one of our clinical advisors here at Frontier. So you'll be learning a little bit more about my role as the presentation goes on. But I will be working in the chat box too. So if you have questions, just feel free to throw them in there. All righty. Thank you.
Hello, folks. My name is Richard Colkay. I'm here on behalf of the admissions team, and I'll also be assisting in the chat. And that's great to have everybody here. Thank you.
And then we have some folks from the marketing department as well here. I think Quincy's here, and I'm not for sure if Brittany's here or not yet. So.
Now I'm here and I'm just here on the marketing team, and we wanted to let you all know that everyone who signed up for this webinar will get a recording afterwards.
Thank you, Quincy. Okay, so let's get started. I want to be respectful of everyone's time. So like I previously said, we're here to talk about the Psych Mental Health Nurse Practitioner program at Frontier. And one of the first things on this slide that I want to bring out is the subtitle that says Creating a Culture of Caring. You're going to hear a lot about this culture of caring as we get into the talk tonight. And as you become more familiar with Frontier, you're going to become more familiar with the culture of caring. Basically, the culture of caring is a framework that we use to really base our everyday life on. We respect each other, we care about each other, we want to provide support to each other. And basically, it just underscores the fact that you are part of our community here at Frontier. We're all about professionalism, inclusivity, respect, mutual support, and we really just want to support each other in a way that helps everybody feel welcomed, valued, and make sure that you realize that you're part of our community and we are invested in your success. That's something that we really hold near and dear to our heart. We care about you as our community members. And like I said, you'll hear more about that as we get more into the discussion this evening. And so I've introduced myself, Dr. Piper introduced herself, and we're excited to be able to talk with you this evening. So let's look at this first slide here. This was a picture that was taken on our new campus in Brussels, Kentucky. And you kind of see a bunch of students, community members, faculty, staff, were kind of together in a circle. And this actually took place during one of the on-campus events that we have during the course of a year. We really like to spend some time with each other at the end of the day, at the end of the week, and we like to reflect upon the things that we've talked about, the things that we've experienced, and really we want to give people an opportunity to just really talk about how they feel about the entire experience. We really hold firm to the belief that the more connected you feel in your educational pursuits, the greater your success. And one of the things that we find here at Frontier is students not only come to campus and they get an orientation and they kind of get socialized into the culture, but also they develop friendships, they develop relationships that last way after graduation. Students make friends for life while they're here on campus. And we like to give everyone an opportunity to be part of our group, our community. And like I said before, we want everyone to feel valued and welcomed. So that's kind of what we do throughout the course of the week. We like to just have touch points to where we can get together and just hear from everyone. You see our mission down here at the bottom of the slide, and I won't read that to you, but you can kind of look over it. But I do want to call out some attention to the words that really resonate with me when I look at our mission and our vision. One of the first things that I see is accessible. You know, our mission is to provide accessible education. And that word accessible is just what it means. We want to give everyone the opportunity to become successful in their educational pursuits. I like to think of Frontier as a school of opportunity, because what we found over the years and what the literature tells us is the more support that you have, if you get the necessary support, you can be successful. And we want to provide that support to you. So that's one of the things that we really pride ourselves on, is we want to be an accessible university. The other thing that I want to bring your attention to is on the second line, where we talk about integration of the principles of diversity, equity, and inclusion. This is one of our foundational pillars. It's who we are as a university and as a community. We value diversity, equity, inclusion, belonging. Again, that kind of goes with the culture of caring. Everyone is important in our community. And we want you to feel valued, respected, and included. We want you to really be able to experience that sense of warmth that comes from such an atmosphere. So we're all about diversity, equity, inclusion, and belonging. We also want to transform. We want to change the landscape of healthcare right now, because I think we've all witnessed the need of good quality psychiatric mental health care in our country. We want to help prepare innovative, ethical, compassionate, and entrepreneurial leaders to really lead us into the next century, the next decades, the next centuries of our vision. We want you to become invested in our community, because we've got some work to do. Like I said, I think we've all kind of experienced the need for quality mental health care, and there's great opportunity out there for us. And we want to be able to say that we're part of your success. So when you come to Frontier, when you interact with faculty and staff, what you're going to find is we treat you like colleagues, because really that's what you are. We want to be able to say that we had just a small piece of your success, and we want to be your mentor. We want to be your coach. We want to be the person that helps you to navigate throughout the basis of your program. And also we want to focus on rural and underserved communities. And so that's kind of who we are at Frontier. And we really do hold this mission statement true. It's like the culture of caring. It drives everything that we do here at Frontier. We are an online distance education program, but we also want to develop that intimate relationship with you as a student that is just as good as or better than what you would receive in a bricks and mortar institution. We want to give you the convenience and the flexibility of online education, but also we want to make sure that we work to preserve, maintain, and just foster those relationships with you as students. So we here at Frontier have been doing distance education for quite some time. A little bit about the program, the Psych Mental Health program. the inception of the program came about around 2017 in response to the growing need across the country for qualified mental health care providers. And so our program is one of the newer programs that we offer. And we like the concept of distance education because you're able to use the community as your classroom. Once that you accept your position in the seat of the class at Frontier, you will come to campus for an orientation period that lasts about 2.5 days. We call that Frontier Bound. You learn all about the campus. You get an orientation to the university. You get to meet faculty, staff. You get to tour this new campus that we have. And then after that, you go off and then you begin your didactic coursework. Now, here at Frontier, the didactic portion of the curriculum is front-loaded. And what I mean by that is you complete all of your didactic coursework first. So you get all of that out of the way, and then you come back to campus for an immersive week's experience where we help you put everything together and prepare you for entry into the clinical practicum. I always say in didactic coursework, you gain a lot of knowledge, but in clinical, you gain wisdom. And I think that's really important for us to remember, because the wisdom that we gain in clinical, really what that's all about is you're learning how to use this knowledge that you've gained in your didactic coursework. And when you come on campus to this immersive experience that we call Clinical Bound, that's exactly what we do. We help you to tie all of the pieces together and help prepare you for entry into the clinical practicum with your preceptor. We have standardized patients who are professional actors, and basically you're in simulation most of the week. And so we have simulation labs that are set up to mimic providers' offices, and the patients come in and they portray the role of a patient. And so what you get to do is just assume the role of the psych NP. You get a chief complaint, you work that through the diagnostic reasoning process, you identify what you think the diagnosis is, and you establish treatment, just like if this was your patient in a real clinic. So we see patients back to back throughout the course of the week. You get feedback from your faculty, from each other, but you also get feedback from the standardized patient. They give you some insight on how it was like to be a patient in your office today. So you get lots of feedback, and we help you to tie everything together so that you feel confident once that you go out into the clinical practicum with your preceptor. So you get to really complete the didactic portion within the comforts of your own home. And then when you start your clinical practicum, we work with you to establish clinical rotations within your community. And so that's really a good, it's a good balance, I think, that we found with students. They enjoy the familiarity of being able to engage in education in familiar surroundings. You also get to travel to beautiful Versailles, Kentucky during that Frontier Bound orientation that I was talking about. Kentucky is known for horse racing. I think it's the horse racing capital of the world. And so we have some beautiful horse farms, just beautiful landscape. Our campus is about 10, maybe 15 minutes from the Bluegrass Airport in Lexington, Kentucky. So it's not a big commute at all to get to our campus, but once that you get here, I think that you will really enjoy yourself, and I think you'll find a home at Frontier. The history of the psych mental health nurse practitioner, nurse practitioners have been around for a while now. Frontier Nursing University kind of got its start in nurse midwifery, but one of the well-kept secrets, I think, with Frontier is that we had the first family nurse practitioner program in the country. Not many people know that, but around 2017, we launched the Psych Mental Health Nurse Practitioner program, like I said, because of the need that we saw across the country. Since the inception of the nurse practitioner role, we've all seen how this has evolved over time. We've seen how that these advanced practice roles have kind of evolved into specialties and subspecialties. And the Psych NP role is kind of one of the most recent roles that we have really seen in advanced practice nursing. We are proud to say that we have graduates that are practicing in all 50 states and some foreign countries. So we do have quite, I think, a footprint over the course of the country. We have a rather large alumni base that continues to be active in the Frontier community, many of which serve as preceptors after they get out into practice. So we're really fortunate, I think, to have such a strong and robust base across the country. Like I said before, we have been doing distance education for quite some time, nearly 100 years now of experience in nurse midwifery and family care. We have students across every state, more than 2,500 graduates, more than 2,500 students, I'm sorry, enrolled, and we have over 9,000 graduates. So we're really, really proud of how big and how fast our program has grown since that it came into being. One of the things that I like to bring out when we talk about growth of the program is the fact that not only have we grown, but we have been successful. I think that's an important fact to kind of point out. This past year, earlier this year, we got the report card from our certifying body, the ANCC, about first-time pass rates for our program. And here's kind of what we found. Over the course of the last 3 years, our MSN students had a first-time pass rate of 99.17%. Our postgraduate certificate students over the course of the last 3 years had a first-time pass rate of 96.92%. So we're really proud of those numbers, because if you look at the national benchmark with the ANCC first-time pass rate, you can kind of see that it hovers right around 90%. So our graduates have consistently exceeded the national average in all domains of this exam. And so that's one thing that you can really have confidence in, is that when you come to Frontier, you can rest assured that you're going to get a rigorous quality education. And we really do have a strong program. You will be well prepared for that entry into practice. Now, success doesn't come without support. I talked about support earlier in this presentation. We want to be able to provide you with the support that you need to be successful. I don't feel that we're successful unless you are successful. So we're dedicated and we're invested in your success. Part of that means that we need to provide you the necessary support that you need. And one of the things that you'll find as you become more familiar with Frontier is we have many faculty, we have many staff members that are here to help support you and navigate throughout your journey. Some of the people that you will come in contact with and develop relationships with are regional clinical faculty members. These faculty members oversee and supervise your clinical practicum experience with your preceptors. You meet regularly with your regional clinical faculty. The clinical faculty meet your preceptors. They come out to your site to visit you and the preceptor sometimes. They really have a wealth of information. All of our clinical faculty are in practice, so that means they're clinically relevant. I think that's very important, because we all know that the landscape of healthcare is a constant change, right? And we want our faculty to be clinically relevant so that they can help you get acclimated into this new role that you're about to embark upon. Also, academic advisors, clinical advisors are here. They have a wealth of knowledge. They help you to navigate term by term, whether that be which courses to register for, how can I really obtain clinical sites, what are some best practices when I'm trying to find clinical sites and that sort of thing. We have an entire program with clinical outreach and placement. So your academic and clinical advisors are there for you, and you will get to know them pretty well. We also have online student mentoring groups because really that's important too, right? We want you to have that feeling of belonging, and we want you to be able to, as students, have an ability to form your own groups to receive support from each other. So we also have various student mentoring groups. We offer financial aid and scholarships. We have a very robust library where you can gain access to a lot of databases and other resources that you need to be successful. And also our Office of DEI offers student interest groups. We also host a diversity impact conference each year where students and preceptors can attend. These are just a few things that we offer to help support students as they, pursue their journey here at Frontier. One of the other things that comes to my mind that we don't have on the slide is that we offer free counseling services to students. So once that you actually become a student at Frontier, you have access to unlimited counseling through one of our behavioral health providers. It's completely free of charge to you. I think everyone could benefit from a therapy session every now and then. That's what I always say. But we really do value mental health, and we know that we all need support at certain times in our life. So that's just another example of some support that we offer you as students. When we talk about scholarships, in 2023, last year, the university awarded over $1.2 million in scholarships. We're really proud of that, and we're thankful that we're able to do that. We have lots of different scholarships that you can kind of look at on the portal page. The scholarships are available during the spring and fall term award cycles. There are some things that we have to kind of look at, however. For example, you must have a minimum of 24 earned credits with FNU to qualify for a scholarship. GPA requirement of 3.25. We have many different scholarships, and the amounts of each scholarship actually vary. But like I said, last year, we were fortunate enough to be able to grant over $1 million in scholarship funds to students. I'm going to let Ms. Wheeler talk about clinical outreach and placement, since that is her area of expertise. You will become well acquainted with Ms. Wheeler. She has a wealth of experience and is always just more than willing to help you and talk with you and discuss clinical placement and so forth. So I'm going to get out of the way for a few minutes, and I'm going to let Ms. Wheeler talk.
All right, thanks, Dr. Scaff. So my name is Jamie, and I'm one of our clinical advisors here. And our relationship with you really starts from day one when you attend Frontier Bound. So that's your orientation session. You will go through many different sessions while you are attending Frontier Bound, with one of those being specifically devoted to how are you going to find these clinical sites and preceptors. So we are with you from day one. Now, I meet with students all day long individually. So if you would like to meet individually, our unit is happy to do that. If you feel like a group setting might be better for you, we also do group clinical advising every term. I just did 4 of those last week. We had great attendance. So you can attend with your peers in kind of a session like this style. And you learn what kinds of questions your peers have. And many of you are facing those same issues. So we're here to help you navigate that. But one of the main things we will do with you is teach you how to use the resources. One of our main resources here we call the community map, and this is just a big database that you will have access to once you attend orientation, and it's a big Google map which shows you sites around the country that we've had past experience with. So they could have a student now, they could have had a student last year, but those are sites that you can kind of dig in and start reaching out to. The SAMHSA site is also a site that I like to use with our students. So it's all about the resources and being a friendly face for you to help through this process. And then we also talk about how to market yourself. So, talking about, an email may not be enough. How might you go in person and really talk to those offices? So I will put our generic email up to the Clinical Outreach and Placement Unit, and you are welcome to reach out if you have any questions. And also, like I said, I'm here on the call tonight, and if you have questions, you can put those in the chat tonight too. All right, thanks everyone.
So good evening. It's my turn to share a little information with you. One of the things that I want to point out is all the things on this slide are our achievements at Frontier. We are a national leader in DEI, a 7-time winner of the Insight into Diversity Higher Education Excellence and Diversity Award, the HEAT Award. We also received the ASIN 2023 award for inclusive excellence, belonging, and sustainability in nursing. We have been recognized as one of the great colleges to work for. This has been 21, 22, 23, and 24. So we're very proud of that. And then when you look at the very bottom, Sigma FNU was named the academic honoree for the 2024 Healthy Work Environment Award. And this was presented at Sigma Theta Tau International this year. So let's talk about degree options. So we have our MSN track here at Frontier. We also have a postgraduate certificate, and we do offer a DNP program. The time frame. So our term system is set up in 11-week terms. We have a 2-week break in between. Your MSN track is 2 to 3 years, depending on how quickly you're navigating those courses. For the postgraduate certificate, it's anywhere from 16 to 24 months. And our DNP program typically takes about 18 months. So the criteria for the MSN student, RN with a current and active license, a bachelor's degree in any field, a 3.0 cumulative GPA from your highest nursing degree. You want to be in good academic standing in your prior educational work and 1 year of RN experience. Our postgraduate certificate criteria, admission criteria, you have to have that RN current active license, a master's degree in nursing, and then that 3.0 cumulative GPA from the highest nursing degree. In advanced practice nurse and one of the following specialties, and you can see that list there. I won't read them all. And then I was looking at our little asterisk down there in the corner. So due to state regulations for our PMHNP program, if you are a resident of New York, that's a little different circumstance. They have suspended the applications except for the DNP. So here are some of our deadlines. Upcoming application deadlines, January the 8th. Coursework would begin April the 7th, which is our spring term. And then our April 2nd deadline, coursework would begin July the 7th, which is our summer term. So the application steps, there's an online application. We do have you write an essay. You'll submit your resume as well as your official transcripts, and then a portfolio for those non-BSN students. And currently our tuition is $733 a credit hour. So when it comes to the clinical experience, your MSNs and PGCs are required to complete 750 clinical hours each. For the DMP track, that's 500 additional clinical hours for that DMP program. And just a little bit about the folks that you would be working with in the PMHMP department. So you met Dr. Scaff, myself, Dr. Piper, the clinical director. You also will have course coordinators, which provide the oversight for each course, whether that be didactic or the clinical courses. And then you have course faculty that are embedded in each of those courses that you may potentially get to interact with. You'll meet your regional clinical faculty, which is assigned to you specifically based on where you are located. This is the faculty member that steps in and provides you the guidance you need, whether it be advising, follows you over the course of your 750 hours while in clinical, grading the assignments that you'll be submitted, et cetera, that kind of thing. So you'll develop a really close relationship with your regional clinical faculty when that time comes. As Dr. Scaff mentioned, we didactic front load, and so you will see them the latter part of your program. You have an academic advisor that will work very closely with you up until you complete your didactic portion, and that academic advisor will still be available to you, but the regional clinical faculty picks up that responsibility when you are completing your clinical courses. And then you've met Miss Wheeler, who is your clinical advisor. And then you will be assigned a financial aid officer as well as a credentialing coordinator. Your credentialing coordinator is who will assist with your preceptors and clinical sites, as well as helping you work through Castle Branch, which is your submission of, your background check, your immunizations, et cetera, those type of things. And then some lovely pictures of our Versailles campus. We are very proud of our campus. It is beautiful, partial. I'm from Western Kentucky. Versailles is located in Central Kentucky, but we love our bluegrass state for sure.
One of the things that you can do with this slide too is you can scan here the image, and you can upload questions about the life of a psychiatric mental health nurse practitioner. But I always like to take just a few moments at this point in the presentation to kind of get some input from you as the audience. And I'd love to be able to have a discussion with you about any questions that you might have about the role of a psych NP. Does anybody have any questions about this or anything else that we've covered so far this evening? And you can just speak up, or you can type in the chat, either one.
I have a question.
Yes.
So do you know if there are, or what is your understanding of integrating behavioral health in rural family practice clinics?
Mm-hmm. I have seen that become more and more of a thing in the recent years. Primary care often has problems with getting patients referred to a psychiatric provider, right? There's extended waiting periods of time and so forth. So what I have seen in this area is I have seen more and more primary care clinics actually start their own psych service line so that they can offer behavioral health services. It's a true model of integration, and I think that it really has improved quality outcomes, because not only can providers more effectively collaborate with each other, but you're part of the same practice. And so there's just that increased communication, I think, that happens as well. And also patients can get in to see their mental health provider in a more timely fashion, oftentimes. The other thing that I've seen sometimes is maybe it's going to be a little bit before someone can actually get an appointment with the mental health provider, but the primary care provider can do a quick consult with one of the mental health providers about a particular patient. And so we can start care at that point as well, and become involved and help the primary care provider, gain some additional insight, get their questions answered, or, we can collaborate and start to look at what a treatment plan might look like for a specific individual. So there's lots of, I think, advantages to that type of care model. And I'm seeing that more and more in our region of the country.
Very cool. And do you find that is happening even without like oversight from psychiatrists? From a okay.
Yeah. And of course, that I think depends upon the state regulations with your boards of nursing and things. But, studies tell us, this is well documented in the literature, especially in rural and underserved areas of the community. The mental health, the quality of mental health in the community improves when APRNs are able to practice to the full extent of their scope. And so we have that well-documented evidence in the literature out there that says that we make a difference in the lives of people in rural and underserved communities, for sure. And so there always is that variation with your state, Practice Act. But I see, for instance, in Kentucky, we have a collaborative model that turns into the opportunity for independent practice after a few years of practice. And what I'm seeing in Kentucky is I see nurse practitioner-owned clinics popping up quite frequently. And so it's certainly possible if your state Practice Act allows it. I see these types of places making huge differences in the lives of people.
That's good. Thank you.
You're welcome. Any other questions out there? Yes.
Hi, I'm Annetta. I just wanted to ask a little bit about how, if you've seen Psych NPs work within the realm of addiction, specifically what it looks like to perhaps prescribe buprenorphine, and do some kind of like integrative model, like between health, mental health, and addiction.
Yeah, I think that's one of the hallmarks of our profession. We operate off of a holistic care model, right? We're more than just a medical model to where when we see a patient come in, we see more than just an addiction process in play. We see more than just a neurotransmitter problem in play, but we actually see the person for who they are that happens to be struggling with X, Y, and Z. And not only are we concerned with what's going on from a pathophysiological standpoint, but we're also wanting to find out what is a day in the life of this person like, right? We want to understand this person. So even though someone may be struggling with addictions, walk me through your day. Tell me how that is and what's your aspirations and how can we, develop a roadmap to get where you want to be. I've told patients time and time again, if we know what the destination is, we can start carving a road out to get there, and we'll work together, to make progress and achieve our goals. But we're much more than just a medical model that really looks at, pathophysiology and neurobiology. That's certainly a part of what we do, but it is not all. And so I think just as a profession, we're embedded, heavily ingrained in health promotion, disease prevention, and we want to get to know the person as an individual because that's so important. And the literature tells us that patients are satisfied with APRNs because of such a thing as that. It's how that we view patients and how we interact with patients. I think that's one of the greatest things of our profession.
Thank you.
Yeah.
Hi, I had a question.
Yeah.
I just wanted to know, in terms of your partnerships with clinical sites in the Los Angeles area, just inquiring because that's where I live at. So I just was inquiring on your partnership.
Awesome. Yes.
How many do you have? And yeah.
Yes, answer part of that, and then I may ask I may ask Ms. Wheeler to talk about the community map and places that we've used in California before. But one of the things that I'm so proud of is our program is entering into the 4th year of a HRSA grant that's called the Behavioral Health Force Workplace and Education Grant. And basically, part of that grant has allowed us to form partnerships with clinics across the country. Now, this is a collaborative approach because we provide certain things to the clinic. The clinic agrees to take so many of our students per term. The preceptors spend time with the students, but then we want the preceptors to give us feedback regarding our curriculum and that sort of thing. And so we really do work together as partners to not only support the success of the student, but also to support the health of the community. Right. So we both have, a vested interest in what we're doing. We continue to add additional partnerships, all the time. And so we have partnerships across the country right now. And so that's one of the things that I really love about the program is because we do offer that, and that helps with clinical placement. The other part of that grant has allowed us to give clinical stipends away each term to students once that they begin their clinical practicum. Now, this is a competitive process, but each term we've been able to give away $7,000 to $10,000 stipends to students to help offset the cost of clinical. You can't use that money for tuition, but you can use that money to help offset any expenses that you may occur as a result of having to go to clinical, whether that be travel, lodging, or whether that be that you're wanting to cut down on hours at work so that you can just fully immerse yourself into that clinical environment. We've been very fortunate to be able to offer those stipends to students as well. Ms. Wheeler talked about the community map, and that's a place where you can go in, you can kind of do a search into your specific area, and you're able to see the sites that we have used before in that particular area. And a lot of the times, students will start there because they will look to see where Frontier has been, so to speak, in their own respective communities. We already have contracts in place with these places. The places already know us. We have a relationship with these places. And so that's a good place to start, I think, as well, by looking at that map. Ms. Wheeler, do you have anything else to add about that?
Yes, so I would say, generally speaking, we have clinical sites in every single state. We have students in every single state out there. I would say it does take active participation on your part to get yourself into these clinical sites. So you want to think about, are there other NP schools in your community? Because if there are, those students are going to be competition for you. You may have to think about traveling a little bit. So I would say the more flexible you can be, is it realistic that you're going to stay 30 miles from home? I hope so for everybody, but, depending on what type of community you're in, some of you in rural areas may not know any psych NPs. There may not be any providers. So that may mean automatically you're going to look at some traveling. Many urban areas are chock full of universities on every street corner. So that makes sense that those students could be your competition. I want to put a plug in here for the telehealth hours, which I don't think we've mentioned yet. But so our MSN students and our PGC students, you're required to do 750 clinical hours. But 450 of those can be telehealth. Okay, so 450 hours of your 750 can be telehealth. So that really opens a lot of doors for you automatically. You can do clinicals wherever you have a valid RN license. Okay, now we're not concerned about any APRN license, just the RN license. Okay, sometimes we find that the telehealth practice is located in one state, but they're actually talking to patients in another state. Well, you'd have to be licensed, where those patients actually reside. Compact, going to another compact is fine, and many students do take advantage of that. Okay. Like I said, the SAMHSA site, and I can put that link up there. But you would not have access to the community map until you attend orientation. But I will put the SAMHSA link up so you can start poking around on there. Psychologytoday.com is another, these are free resources you all have access to. I would encourage you to look at the APNA website too, to see who you already know in your area. Okay. So I will go ahead and put those couple of links in for you. All right. Thank you.
Thank you so much.
You're welcome.
Any other questions about this? It's a good discussion. Okay. So like I said, the life of a psychiatric mental health nurse practitioner is broad too. I always say under the umbrella of mental health, there's so many different avenues that you can pursue as a psych NP. We see psych nurse practitioners work in outpatient clinics, inpatient hospitals, crisis stabilization units, school systems, legal correctional facilities, community mental health centers, health departments, just lots and lots of places for psych mental health nurse practitioners to really work with patients. Any questions about the admissions process?
I have a question.
Yes.
So I understand, like you've mentioned, that there's an essay and there's a resume with the template, and then there's an online form. And for once a cohort's application session ends, then the next day you open a new session for the next cohort. Is that correct?
Yes. Richard, do you want to speak to that? Maybe having internet problems.
Oh, sorry about that, folks. I was on mute there. But
That's okay.
yeah, my apologies again. But the current term, if it's an interest, is spring. So the application deadline to get all those documents in and submitted is January 8th. For coursework for admitted students to begin April 7th. And I'll post that information. I just bring those dates up because if the current term is not of an interest, you'd want to wait until the application opens up for the term of interest. For example, the summer 2025 application, that will open up January 9th of next year. So you just want to be mindful of when you're submitting the application, it's going towards the term of interest, or that prospective start date, I should say.
Perfect. Thank you so much. And then would you say that the forms and the questions are about the same from cohort to cohort?
Yes, at this present time, yeah, the applications process is the same for each term. And I'll post that in the chat as well. In regard to the resume, the essay, all the application requirements are the same, or documents. That's correct.
Excellent. Thank you so much. I appreciate that.
Yeah, you're welcome.
Any other questions about admissions?
Hi, this is Carolyn. I just had a question to see whether or not you accept UK degrees for your program.
Like United Kingdom?
Yes.
So that would be if is a bachelor's degree or higher is the requirement, and then a current unencumbered active nursing license. For students that may be in unique circumstances like what you're describing, there is a portfolio, I think, that you kind of fill out and you speak to certain questions and that sort of thing. So there may be an extra step that you need to really kind of put some information in there about. But that's kind of that. I think that I'm answering your question. Is that helping some?
Okay, I'd like to kind of get some information or further
Sure.
information on the additional steps. Thank you.
Yes, sure. Richard, do you have anything to add to that?
Yeah, in regard to international education, students certainly can that have international education. An evaluation would be needed, and then Frontier recommend using West World Education Services. I'll post that information in the chat as well, and then I'm going to post our information for admissions in case anybody has specific questions or need clarity on anything after the fact.
Thank you so much.
You're welcome. Thank you.
Any other questions?
Dr. Scaff, would you mind answering the question about how transfer credits are evaluated? Because I know that does come up.
Sure. So when we look at transfer credit, let's say, for instance, you have taken one of your 3 Ps, we call it, right? Advanced pharmacology, pathophysiology, and physical assessment. Let's say that you have taken those particular classes at another university and you would like to submit a request to have transfer credit for those particular courses. So if that is something that you find yourself wanting to do, we do have a process for that. You would have to gather your old course syllabi and transcripts and submit it, and we would look at that and do a gap analysis to see how well aligned the course objectives are, the grading system, and all of that stuff to be able to make a determination. Now, having said that, one of the things that we really look at is across the lifespan content in some of these courses. That's probably one of the biggest things that I see when students are wanting to earn or be granted transfer credit. Our certifying bodies, the ANCC and the AANP, require that courses include content that is across the lifespan, because that's part of your degree. That's part of your scope of practice. And so when we look at courses, we're specifically looking at things like terminology and the course objectives, the course, the description and that sort of thing about across the lifespan terminology. And so that's one of the things that we look at, because we have to ensure that those courses meet that benchmark, because we don't want you to get to the time to sit for your exam and the certifying body decline your application because there's no evidence of across the lifespan content in some of these courses that you want to transfer in. So we look at that. Number one is for that across the lifespan thing. The credit hour has to match. For example, if we have a 4-hour advanced physical assessment course, then you would have to have a 4-hour physical assessment course that you had previously taken that you wanted to transfer in for credit. So the credit hours have to match credit for credit as well. They all have to be at the advanced practice level, graduate level, and so forth. So those are some of the things that I see with transfer credit. Once we get into the management courses, and those are really the meat and the potatoes of the psych curriculum, we don't accept transfer credit for any of those management courses. And so that's one of the things that we always tell students. You can transfer in some courses like your 3 Ps, but once you get into the hardcore fundamental management courses like psychopharmacology, psychiatric assessment, psychotherapy, Once you get into those management courses, we don't accept transfer credit for those specific courses. Any questions about that? But if you have questions about that, you can always email either me, the registrar, admissions. We can help you get your questions answered when it comes to transfer credit and gap analysis. Okay. I think we've talked about clinical placement questions, but are there any other questions out there that somebody wants to pose? One of the things that I would want to underscore here, and this goes for the whole process, but specifically clinical site placement. Ms. Wheeler talked about that it's really going to take some time and strategic planning, I think, to start looking at clinical placement. We tell students to start looking for clinical sites when you first get admitted, because it does take some time. You will find that oftentimes preceptors have waiting lists, right? And so that's something that we see nationwide. But one thing that I do want to underscore is the fact that we really do work hard to provide support for you as you go forth and you start looking for these clinical sites. Like I said, we have an entire department on clinical outreach and placement. We have our clinical partnerships that we've established through the BWEC grant. We really do try to help you, and we really do want to provide that support. One of the things that you're going to find about Frontier is we are collaborative. You're more than just a number to us, but you're part of our community, and we want to work with you one-on-one. We want that relationship with you so that we can help you. So you're not on your own, I guess, is the story I'm trying to tell. Yes, it is going to take some work, but we want to work with you, and we will give you the support that you need. So just be proactive in your planning, involve us from the start, and we'll work together to help you secure clinical sites. The last thing is a little quote. Success doesn't come to you, you go to it. This is one of our alumni and graduates that coined this phrase. And this is something that, you know, we always leave students with, prospective students, is that success doesn't come passively. We do have to work towards success. But like I said at the beginning of this presentation, we want to invest in your success. You can be successful if given the necessary support. And we want to be here to support you every step of the way. We want to be able to inherit a little bit of success. If we feel like that we can just be a little part of your success, then we've really done something. So we want to help you become successful so that you can achieve your goals and your ambitions. If you have questions, please do not hesitate to reach out to any of us. You can see some email addresses here on the screen as well as in the chat. We're all here to help you, and we're more than happy to help you. Just reach out to us and we will help you get your questions answered. Any final questions? Faculty, staff on the call, anything that you guys want to add as far as closing remarks?
I just say on the admissions team, if anybody has further questions, the contact number I posted in the chat, but it's 859-2 279-0890. And then the email address, it's fnuadmissions@frontier.edu. So please reach out if you have questions or need anything going forward. Thank you.
Miss Wheeler, anything from you?
I would say, we're here to help you be successful. It does take active participation on your part for those clinical sites, but students are doing it every day, all day long, and Frontier confers degrees every single day. So you can be successful. We're here to help you make it happen. All right. And I'll put my generic email up if you have questions for our unit too. All right. Thanks, everyone.
Dr. Piper?
I just want to say thank you again for popping into our little Q&A. It's very exciting to embark on such a journey as this because the need is so great, and we all have a purpose, and I can see that purpose for you potentially is this particular track. So just let us know how we can help. We are here to support you as you embark on this educational journey.
And Quincy, you said that everyone that had registered will receive a recording.
Yes, that's correct.
Okay. Awesome. So any closing questions or comments from the audience? We really appreciate you making time for us this evening to talk about Frontier and our program. Thank you so much for joining. And we look forward to hearing from you. If you have questions, please don't hesitate to reach out.